Welcome to Prep Pass. Here are 20 real ServSafe Food Protection Manager practice questions with answers for 2026. Read each question, then try to answer before the 5-second timer runs out. For the full free practice test, just search preppass.org. Let's begin. Question 1. A cook at a taqueria assembles cold chicken tacos, placing shredded chicken, cilantro, and onion directly onto tortillas that will be served without further cooking. How should the cook handle this ready-to-eat food? A. With clean bare hands, as long as they washed recently. B. By first dipping bare hands in sanitizer. C. Using gloves, tongs, deli tissue, or other utensils to avoid bare hand contact. D. Bare hands are acceptable because the food is cold. The correct answer is C. Food handlers may not touch ready-to-eat food with their bare hands. They must use suitable utensils such as single-use gloves, tongs, spatulas, or deli tissue. Even clean, recently washed hands can transfer pathogens like norovirus and Staphylococcus aureus. Sanitizer does not replace this barrier, and the rule applies whether the food is hot or cold. Question 2. According to the FDA Food Code, what is the minimum total time a food handler should spend washing hands, from wetting to drying? A. At least 20 seconds. B. At least 5 seconds. C. About 3 seconds. D. Exactly 60 seconds. The correct answer is A. The complete hand washing procedure must take at least 20 seconds, which includes vigorously scrubbing hands and arms with soap for 10 to 15 seconds. 5 or 3 seconds is far too short to remove soil and pathogens, and while 60 seconds is thorough, the code sets 20 seconds as the minimum standard, not a fixed 60. Question 3. A prep cook finishes cutting raw chicken and is about to start chopping lettuce for salads. What must the cook do first? A. Change aprons only. B. Wash hands, because hands must be washed after handling raw meat and before working with other food. C. Rinse hands with water only. D. Spray hands with sanitizer and continue. The correct answer is B. Hands must be washed after handling raw meat, poultry, or fish and before switching to ready-to-eat foods, to prevent cross-contamination with pathogens like salmonella. A quick water rinse or a spray of sanitizer does not remove the load of pathogens the way soap, warm water, and 20 seconds of scrubbing do. Changing aprons alone does not address contaminated hands. Question 4. A manager sees a cook rinsing a cutting board in the handwashing sink. Why is this a violation? A. Handwashing sinks are too small for boards. B. The sink water is not hot enough. C. It wastes water. D. Handwashing sinks may be used only for hand washing, not for washing equipment, food, or dumping liquids. The correct answer is D. A hand-washing sink must be used only for washing hands. It may not be used to rinse equipment, prep food, or dump mop water, because doing so can contaminate the sink and discourage proper hand washing. The problem is not the sink size or water temperature. Equipment must be cleaned in a designated warewashing or prep sink instead. Question 5. Where is a food handler permitted to wash their hands in the establishment? A. Only at a designated hand-washing sink, never in a prep, utility, or dish sink. B. In any sink that has soap nearby. C. In the 3-compartment warewashing sink. D. In the mop/utility sink to save time. The correct answer is A. Hands may be washed only at a sink designated for hand washing, not in sinks used to prepare food, wash dishes, or dump mop water, because those sinks can cross-contaminate hands or food. A hand-washing sink must be stocked with warm running water, soap, and a way to dry hands. Convenience is never a reason to wash hands in a prep or utility sink. Question 6. A cook wearing single-use gloves takes out the trash, comes back, and starts plating salads with the same gloves. What is the correct practice? A. Wipe the gloves with a towel and continue. B. Remove the gloves, wash hands, and put on a new pair before returning to food. C. Turn the gloves inside out and reuse them. D. Spray the gloves with sanitizer and continue. The correct answer is B. Single-use gloves must be discarded and hands washed whenever they become contaminated, such as after taking out trash, and a fresh pair put on before handling food. Gloves are single-use only, they cannot be wiped, sanitized, or reused. The hands must be washed between glove changes because the gloves themselves do not replace hand washing. Question 7. When must single-use gloves be changed during food preparation? Select the best answer. A. Only at the end of the shift. B. Once every 4 hours no matter what. C. When they tear, become soiled, after a task, or after 4 hours of continuous use with the same food. D. Only when a manager tells the cook to. The correct answer is C. Gloves must be changed when they are torn or soiled, when switching tasks or foods, after handling raw meat before touching ready-to-eat food, and at least every 4 hours of continuous use. Waiting until the end of a shift lets contamination build up. A strict 4-hour rule alone ignores tiers and task changes, and glove changes should not depend on a manager's reminder. Question 8. A dishwasher tells the manager she has been diagnosed with a norovirus infection. Under the food code, the manager must A. Move her to the front counter. B. Let her keep working if she wears gloves. C. Do nothing since she only washes dishes. D. Exclude her from the establishment and report as required, until she is cleared to return. The correct answer is D. An employee diagnosed with norovirus, one of the big 6 pathogens, must be excluded from the establishment and can return only when cleared per the code, generally after being symptom-free at least 24 to 48 hours with regulatory approval. Gloves, reassignment to the counter, or ignoring it because she only washes dishes all leave a highly contagious pathogen in the operation. Question 9. Which single symptom, reported by a food handler, requires the manager to exclude, not just restrict, that employee from the operation? A. Vomiting or diarrhea. B. A mild seasonal cough. C. A headache. D. A tired, watery eyes. The correct answer is A. An employee with vomiting or diarrhea must be excluded from the operation because these symptoms strongly signal a transmissible foodborne pathogen. A restriction, keeping the person away from food and clean equipment, applies to lesser situations, but active vomiting or diarrhea calls for full exclusion. A cough, headache, or tired eyes alone do not by themselves require exclusion. Question 10. A food handler at a restaurant that serves a nursing home reports jaundice, yellowing of the skin and eyes, that began 2 days ago. What must the manager do? A. Restrict the handler to non-food tasks only. B. Exclude the handler and notify the regulatory authority. C. Let the handler work in gloves. D. Send the handler home for 1 hour, then allow return. The correct answer is B. A food handler with jaundice that appeared within the last 7 days must be excluded, and the regulatory authority must be notified, because jaundice can indicate hepatitis A, one of the big 6. This is especially critical where a highly susceptible population such as a nursing home is served. Restriction, gloves, or a brief break are not sufficient responses to jaundice. Question 11. A server reports a sore throat with a fever. Where the establishment serves the general public, not a high-risk population, what is the correct action? A. Exclude the server for 30 days. B. Ignore it, since a sore throat is minor. C. Restrict the server from working with food and food contact surfaces until they are symptom-free or have a medical release. D. Let the server keep waiting tables normally. The correct answer is C. A food handler with a sore throat accompanied by fever must be restricted from working with food and food contact surfaces, but need not be fully excluded when serving the general population. Exclusion is required only when a highly susceptible population is served. Ignoring the symptom or continuing to serve tables normally risks transmitting streptococcus. A 30-day exclusion is not the code standard. Question 12. A cook has a small infected cut on a finger. What is the correct way to allow this cook to continue working with food? A. Leave the cut uncovered to let it breathe. B. Cover it with a paper towel and a rubber band. C. Simply wash hands more often. D. Cover it with an impermeable bandage and then a single-use glove or finger caught over the bandage. The correct answer is D. An infected wound or lesion containing pus on the hand must be covered with an impermeable, waterproof bandage and then a single-use glove or finger caught, because Staphylococcus aureus in the wound can contaminate food. Leaving it uncovered or using a paper towel provides no barrier, and extra hand washing alone does not contain an infected lesion. Question 13. A cook wants to sip from a cup of soda while working on the prep line. Under the Food Code, drinking in food prep areas is A. Allowed only from a covered container with a lid and a straw, and away from exposed food and clean equipment. B. Never allowed anywhere in the building. C. Allowed freely from any open cup. D. Allowed only if the drink is water. The correct answer is A. Employees may drink in food prep areas only from a container that is covered with a lid and straw, held so that hands and the food are not contaminated, and away from exposed food and clean equipment. Open cups are prohibited because they can spill and expose the drinker's saliva to the hands. The rule is not limited to water, and reasonable drinking areas are allowed, so a total building ban is incorrect. Question 14. Which activity is prohibited while working in food preparation and service areas? A. Wearing a clean apron. B. Smoking, vaping, or chewing gum/tobacco. C. Washing hands frequently. D. Wearing an effective hair restraint. The correct answer is B. Smoking, vaping, and chewing gum or tobacco are prohibited in food prep and service areas because they encourage hand-to-mouth contact and can contaminate food and surfaces. Employees who eat, smoke, or chew must do so only in designated areas and wash hands afterward. Wearing a clean apron, washing hands, and wearing a hair restraint are all required good practices, not violations. Question 15. A manager checks a new prep cook's hands. Which fingernail condition meets food code requirements for someone handling exposed food? A. Long natural nails, as long as they are clean. B. Artificial nails without gloves. C. Nails trimmed, filed, and clean, artificial nails or polish only if gloves are worn. D. Chipped polish is fine on short nails. The correct answer is C. Food handlers must keep fingernails trimmed, filed, and clean so they can be maintained. If they wear nail polish or artificial nails, they must wear gloves when touching exposed food, because polish can chip into food and artificial nails can harbor pathogens and break off. Long nails and chipped polish trap soil and pathogens. Clean, short natural nails are the safe standard for bare hand tasks like hand washing. Question 16. Which piece of jewelry is a food handler generally permitted to wear while preparing food? A. A wristwatch. B. A medical alert bracelet with a charm. C. Several rings with stones. D. A plain band ring with no stones or grooves. The correct answer is D. While preparing food, a food handler may wear a plain band ring, such as a wedding band, with no stones, but must remove watches, bracelets, and other rings, because jewelry can harbor pathogens, fall into food, or catch on equipment. Rings with stones and bracelets create crevices that are hard to clean. A plain smooth band is the only commonly allowed item. Question 17. Why must food handlers wear an effective hair restraint such as a hat or hairnet? A. To keep hair from falling into food and to reduce the temptation to touch the hair with the hands. B. Because uniforms look more professional. C. To keep the handler's head warm. D. Only because customers dislike seeing hair. The correct answer is A. Hair restraints such as caps, hairnets, and beard covers keep hair out of food and discourage handlers from touching their hair, which can transfer oils and pathogens to the hands. The purpose is food safety, not just appearance or comfort. Loose hair is a physical contaminant and a route for Staphylococcus that lives on skin and hair. Question 18. A cook spills raw egg on the front of his apron early in the shift. What should he do? A. Keep wearing it until the apron is fully soiled. B. Remove and change the soiled apron, and wash hands before returning to work. C. Wipe the apron with a wet cloth and continue. D. Turn the apron around to hide the stain. The correct answer is B. Soiled clothing and aprons must be changed when they become contaminated, such as with raw egg, because they can transfer pathogens to food and hands. The handler should also wash hands. Wiping the apron or turning it around does not remove the contamination, and waiting until it is fully soiled allows cross-contamination in the meantime. Aprons should be removed before using the restroom or taking out trash as well. Question 19. Which of the following situations does not by itself require a food handler to wash their hands? A. After using the restroom. B. After touching the face, hair, or body. C. After putting on a clean apron over already clean, freshly washed hands. D. After handling raw chicken. The correct answer is C. Handwashing is required after using the restroom, touching the body or hair, handling raw animal foods, coughing or sneezing, taking out trash, and before starting food work, among others. Simply tying on a clean apron over hands that are already clean and freshly washed does not, by itself, contaminate the hands. All the other options involve clear contamination that demands washing. Question 20. A busy cook wants to use a hand antiseptic, hand sanitizer, instead of washing hands. When is this acceptable? At any time, since sanitizer is stronger than soap. B. Instead of washing after using the restroom. C. Whenever the hands look clean. D. Only after properly washing and drying hands, sanitizer is applied in addition to, never in place of, hand washing. The correct answer is D. Hand antiseptics may be used only after hands are properly washed and dried. They supplement but never replace hand washing, because sanitizer does not remove soil and is less effective on soiled hands or against some pathogens like norovirus. Using sanitizer instead of washing, especially after the restroom, is a serious violation. Hands that merely look clean can still carry pathogens. That's all 20 questions. Want the full ServSafe practice test with hundreds of questions, completely free? Just search preppass.org. Good luck on your exam.